Welcome back to the Citrus Today Show. Glad to have Dr. Matt Lasorsa back in the studio with us. Yes. From Citrus Hills Dental.
Thank you, Dennis.
And you brought a special guest with you today.
Yes.
This is Judy Hitchcock. Glad to have you in the studio.
Why, thank you. It's good to be here.
We're going to talk about something we talked about the first time we had you here. Judy's had the chance to experience it, yes, and firsthand can talk about implants, how they work, and the whole adventure, if I can call it that, of having implants put in.
Okay.
I gather it was very pleasurable because you've got a great smile today.
Why, thank you. Thank you. It's been a good experience.
Okay. Well, for those who missed the first time we had you in the studio and don't know what we're talking about when we talk about implants, this is something that it's not new technology, but to a lot of folks in the audience, it may be new. They've never heard of that. They've heard of false teeth. They've heard of partials and these kind of things. But describe implants to us first off.
Okay. Implants are made of a titanium alloy, and their purpose is to replace a missing tooth or a missing root. Okay. And there's a number of options you can use them for. You can use them for a single tooth. You can use them for a fixed option like a bridge. You can use them to retain a denture to help hold your denture in, or you can use it to retain a partial denture so the partial denture fits a little better. You can also use implants for what we call a full mouth reconstruction, meaning somebody that has no teeth at all. We can add a number of implants and stabilize it and give you a full arch of teeth, whether that be a denture or what we call a roundhouse, a full arch of a porcelain bridge.
And you've brought several different samples with us today to take a look at and describe, the different styles, the different ones that are in place, uppers and lowers. There's a lot when it comes to teeth to be said. We all want a great smile. That is ultimate in importance to everybody, I think. And if you're having trouble with teeth, then something like an implant can really make a big change in your life, right?
Absolutely.
Let me just ask you, Judy,
sure.
When you got your implants in, did it make a big change for you?
Night and day. It was just, and it's not just the smile, which is very, very important, but it's eating.
Yeah.
I mean, all the difference in the world. I can't even tell you how happy I am that I did it.
Well, describe some of these different styles here that you have in front of us, Doctor.
Okay. This is what we do a lot of with people that are wearing dentures, especially a lower denture, have trouble keeping the denture in, have trouble eating with it. They're conscious of wearing adhesives, or it might fall out when I'm laughing or talking or something like that. So a lot of people come in for these mini implants, which we can usually do in one visit. If somebody's already wearing a denture, we may be able to use their existing denture, or we can at least put their implants in and construct a new denture that will be custom fit around the implants, and that will snap on to these mini implants, and then they can use them like a natural tooth. That was an upper model I just showed you. This would be lower.
Right.
There's some O-rings under here that will snap onto the implant.
Now, is the O-rings and the implants a permanent thing, or do you have to have adjustments to that down the road?
The O-rings tend to wear out after a couple months. We have to change those about once or twice a year. But we do that at their cleaning visits. Once the patient has their implants, we like to come in twice a year for cleanings. We inspect them, and we'll replace the O-rings so it feels nice and snug again.
That's not rebuilding the entire thing. It's just a small O-ring that's inside the.
Yeah, it's just changing the O-ring out is like it's just something that snaps in and snaps out. We can do it in a few minutes.
Okay.
This is
a partial type implant.
This is a partial denture option where someone may have some existing teeth, but they have a tough time wearing a partial denture because it may rock or may be a little uncomfortable that it's riding on the teeth. So a lot of times we can add one or two of these mini implants towards the back or wherever they need it for support. And this is constructed similar to a denture that it'll snap on and it'll help stabilize it. And that's a lot more comfortable and a lot more functional for the patient.
Let me ask Judy, before we take a look at these different styles, did you have dentures before you had the inserts?
No, I did not.
Okay.
I went the entire From
period
the
without?
beginning, no, I went from extractions to the implants to having dentures made, and it was, yeah, I went in there with bad teeth and came out looking like this.
Wow, that's great. Did it take you long to make this decision?
Not really, no. Once I saw Dr. Lasorsa and, went home and thought about my options, it didn't take me long at all. Less than 2 weeks to
Less than 2 weeks.
call back and make an appointment to start the ball rolling.
Okay. What are these here now that we see?
Let me explain what Judy went through.
Oh,
Because,
okay, that's a good idea.
Because Judy came in with, if you don't mind me saying, a lot of periodontal disease, a lot of teeth that were in the dental world we call hopeless. No matter what kind of work we do to them, they're not going to last. Okay, she had some abscesses around her gums and her teeth. So her first step was that we made what we call a healing denture or temporary dentures ahead of time for her, so that the day we extracted the teeth and replaced it with bone grafting, she got teeth in that day. She got dentures in that she could take home that day. When we have multiple teeth extractions and abscesses like that, the bone isn't very healthy. Okay, there's a lot. We have to wait for healing.
Right.
So I like to place some bone grafting in there to help regrow that bone, so that she has some nice healthy bone a few months down the line to go ahead and support her implants. So she went through that first. She went through the healing phase of extractions, temporary dentures, and bone grafting, and then we wait a couple months for that bone to fill in and solidify until I determined that her bone's healthy enough to support these implants. Then we went ahead and placed her implants and started constructing the new dentures that are a lot more custom fit to the implant.
During that process, from the start to when you got the implants, was there anywhere in there that you said, boy, did I make the right decision? I'm sure viewers out there would ask that question if they were here.
The temporary denture just about drove me crazy, but it was well worth it.
It was well worth the wait.
It was well worth it.
The smile shows it.
Yes,
okay.
it was.
Well, we have more to talk about, so we'll do that as we continue. Stay with us, everybody. We'll be back right after this on Citrus Today.